Hi everyone, welcome to Meet Dr. Jima. Today we are going to talk about vaginitis. Vaginitis is an inflammation of the vagina that causes itching, burning, discharge, and odor. There are many kinds of vaginitis, but we're going to talk about the most common ones and we're going to focus on 4 of them. Let's talk about it. A quick overview. I want you to understand that the vagina actually harbors bacteria and fungus in its normal function. They work together to keep a good flora in the vagina for it to function the way that it's meant to. Whenever there is an imbalance between the fungus and the bacteria in the vagina, or in between the bacteria themselves, this leads to an inflammation, hence vaginitis. When it comes to a yeast infection or Candida vaginitis, this is simply an overgrowth of yeast in the vagina. Typical symptoms that you would see includes itching and burning, typically of the vulva. The vulva is the outside of the vagina. The burning can worsen with urination. There may also be a whitish, lumpy, odorless vaginal discharge. Most people with a yeast infection will typically have some of these symptoms. Now, there are also certain things that trigger these yeast infections. Number 1, use of antibiotics. Typically, if you've been on antibiotics for some time, the antibiotics can actually kill some of the bacteria in the vagina, giving more room for the yeast or the fungus to grow and hence developing all these symptoms we just talked about. Number 2, hormonal changes. When you're pregnant or when you hit menopause or you're breastfeeding, the changes in your hormones actually affect the growth of bacteria and the yeast in your vagina, hence increasing your risk of a yeast infection. Number 3, diabetes. If you're a female and you're diabetic, there is also an increased chance of recurring yeast infection because of the changes in the vaginal flora from the extensive accumulation of sugar or glucose in the vagina. We also tend to see significant reoccurrence of yeast infection in women that are immunocompromised, be it from an HIV infection or other immunosuppressive conditions.
Dr. Jima, what can I do about it?
Well, try not to douche. Douching essentially means irrigating or cleaning the vagina with plain water. This actually changes the flora in the vagina and allows for increased growth of yeast. Do not use scented tampons or feminine hygiene sprays. You can use plain water to clean the vulva. Once again, the symptoms for yeast infection can be vaginal itching, burning, which is typically worsened with urination. There may be a white, lumpy, odorless vaginal discharge as well. If your clinician is suspecting a yeast infection, there are 2 things they can do. They can essentially do a wet mount, which is collecting a sample and running it under a microscope right in the clinic, and this is what they would see. Then after that, they can treat you. The other thing they can also do, they can have you do a self-swab and send it over to the lab and run it for not only the yeast, but also the Trichomoniasis, Bacterial Vaginosis, chlamydia, and gonorrhea. Whatever the situation may be, we do have topical and oral antifungals that helps treat these symptoms. If you have any of these symptoms, do not be shy. Just go in and talk to your primary care provider, go to a nearby urgent care, and we will gladly take care of you. The second type of vaginitis, which is relatively common, is the Trichomoniasis Vaginitis. This is a sexually transmitted infection. This is caused by a parasite known as Trichomoniasis Vaginalis. This typically causes a yellow-gray or a yellow discharge. It may have a fishy odor. Some people that suffer from this will also have a burning, irritation, redness, and swelling of the vulva. This is a sexually transmitted disease and we highly recommend that you get treated. We do have antibiotics to treat this specifically, and it's also highly recommended that you treat your partner.
Dr. Jima, how can I prevent this?
Well, you can prevent this by wearing condoms during sexual intercourse. If you are not in a monogamous relationship, it is highly recommended you use some sort of physical protection. The third vaginitis we're going to talk about is bacterial vaginosis. This is as a result of changes in the balance between the bacteria that resides in the vagina. This typically causes a very strong fishy odor and an increase in vaginal discharge. Typically, the discharge may appear to be thin and dark or gray. or greenish. The odor is typically amplified after sex or during your menstrual period. This is easily treated with oral antibiotics. I must emphasize this is not a sexually transmitted infection. This is merely an imbalance between the bacteria that resides in the vagina. The last type of vaginitis we're going to talk about today is atrophic vaginitis. It simply means a dry vagina. This is not an infection. This is merely because of decreased hormone and therefore causing dryness of the vagina. Because of the dryness of the vagina, it could cause severe pain during sexual intercourse. It can cause burning and itching as well. We tend to see these in postmenopausal women where the estrogen level is relatively low, or in women who are breastfeeding. I must once again emphasize this is not an infection. It is merely just decreasing hormones, and therefore it is treated by supplementing the hormone that is deficient. In this case, it's most likely an estrogen. Overall, all these different types of vaginitis causes significant discomfort, be it burning, itching, discharge, pain. It makes you feel very uncomfortable. But you have to understand that we have treatment for all these. It just needs to be appropriately diagnosed and treated well. If you like this video, please like, subscribe, and turn on the notification button so you don't miss out on the next one. Dr. Jima, I'm out.